for them to get the knowledge to take in charge of their health. Really, my desire is for them to get rid of the root cause of these issues, to get to optimum health. And today, I'm going to be talking about chronic issues. You may know, or maybe you are suffering from health issues that are chronic. When I say chronic, is that it's been going on for years and years, and you have not been able to resolve these issues. There's still something missing. This is what I would talk about, is that piece of the puzzle that has been missing for a lot of cases that I've seen. And when I talk about chronic issues, I talk about like cancer, heart disease, autoimmune problems, arthritis, pain, inflammation. So as you can see, it's pretty much everything that people are dealing with is issues that has been going on for a long time, and despite taking medication or diet changes or whatever, is still something there. And the key, the missing piece of chronic issues, this is what I see with pretty much every cases of autoimmune disease or cancer or Parkinson, neurological issues like autism, inflammation and pain. It's actually Lyme disease. We don't talk a lot about Lyme disease because a lot of doctors are afraid to talk about it. This is not really common. It's chronic. It's hard. It stays in the body. But in every case of chronic issues, I always see Lyme disease. And Lyme disease is the missing piece to health problems. So Lyme disease is a lot more common than what people think about. So a lot of medical doctors believe that Lyme disease is mostly on the East Coast. It did start on the East Coast decades ago, but since then it has spread to all the countries. I have listened to some doctors, science showing that maybe around 70 and 80% of the population could potentially have Lyme disease. Which is a lot more common than you would think. And medical doctors don't really think about this because they don't believe it's a thing. And they do find it, they don't really know how to treat it. So I see all kinds of people coming to me. They've tried everything for Lyme disease. They've tried the antibiotics for months and years and years. They tried the IV. They tried all kinds of different things that the medical doctors recommend, but you cannot get rid of Lyme disease through these different Western approaches. It's really impossible. And Lyme doctors will say actually that when you have chronic Lyme, you typically have it for life. You just have to maintain it, stay where you are, so it doesn't get worse. But me, what I say is, it is possible to get rid of Lyme. As a matter of fact, I had Lyme myself when I was a teenager, and for 10, 15 years, I tried to find answers to my problems, but no doctors really diagnosed me with Lyme until I found one doctor that thought that all my issues, I have so many different health problems, that all of them were actually connected to Lyme. So she tested me for Lyme, and I had it. So I had different things, different confection. I had some parasites, some candida. So she really put me on a nutritional program. I tried the medical route. It didn't work for me. All those different things that people try, I tried. It didn't work. I got worse. If you can imagine, if you take antibiotics for a long time, you wipe your gut off the good bacteria, and you have more issues, and that's what happened to me. So my gut was all destroyed. My body was all impacted by those medications. So when I saw this holistic doctor, she really put me on a nutritional program. And it took me about 2 years to actually be clear of Lyme. And today, I do not have Lyme disease. I don't have co-infections anymore, and so on and so on. So when people come to me, they have Lyme, and they tell me, oh, my doctor said that I have Lyme for life, so I have to deal with it. So I have to undo their thinking and let them realize that it is possible to get rid of Lyme. The key here is to support your body, and your body, your immune system, knows how to fight and get rid of Lyme. Because Lyme is a bacterial infection, and there's co-infection like Babesia, Bartonella, and it is believed that ticks are the main carrier of Lyme. So a tick carries somewhere between 25, 30 co-infections, pathogens. They have viruses, they have bacteria, they have parasites, they might have yeast as well. So typically when people get bit by a tick, it's more than just Lyme. There's maybe a EBV going, a virus, maybe there's a bacterial infection along with the Lyme, maybe there's a parasitic infection as well. So it's typically many different components that we need to consider. And that's why more medical doctors don't go that route, because it's hard, it's confusing, they don't know what to do. And the only thing they do is antibiotics. I haven't seen somebody yet cured by Lyme using antibiotics. It just doesn't happen, because those bacteria and co-infections tend to hide deep into tissues. So when you take antibiotic for some time, your blood might be clear from Lyme. So when you do blood work, Western blot, you may not see it because the Lyme actually got out of the blood and it's hiding into different parts of the body. And that's what happens all the time. Actually, that's what I see with people is when they start antibiotics, the Lyme just goes back and it's worse because you have the Lyme now back in the blood and lymphatic, and then it just gets worse. It really damages the organs. So the key here is to boost your immune system to be able to get rid of it. So we need to look at the gut function. I think that's the key, and a lot of Lyme doctors don't realize that, is when you take antibiotics, like I said, you wipe everything off in your gut, so you don't have good bacteria anymore. And then you have this risk of having biofilm. So biofilm is a community of bacteria, yeast, parasites, different pathogens. And it's a biofilm, it's like a small sheet that is forming around the lining of your gut. And the biofilm is really highly resistant to antibiotics. Antibiotics do not kill this biofilm. Sometimes doctor will say, yeah, you can use this to kill it, destroy it, but it's really hard. It's really resistant. You can use it using natural or different herbs. But when it comes to medical options, antibiotics actually promote, increases the formation of biofilm. And the biofilm is a really good place for the Lyme, co-infection, and parasite and yeast to hide. And that's why it's really hard to get rid of Lyme using antibiotics, because you need to get rid of this biofilm. And this is the key when it comes to functional medicine, natural options, is to get rid of this. So it's to address the yeast component of it. And specifically, it's to target the parasitic component. Because we know there's parasites in your gut that the Lyme and bacterial infection can actually get into the parasites. So, and we know that parasites are resistant to antibiotics. So you can take antibiotics, and the Lyme and infection stay in that parasite or in different types of parasites. And then when you stop, it comes right back out, leading to more infection in the body. So we need to address the yeast, like I said, and the parasite. To me, when it comes to chronic issues, parasite is really the first thing we need to do. And when it comes to Lyme, that's exactly what's going on. And that's why the medical community cannot get rid of Lyme, because they don't look at the parasite component of Lyme disease. And to me, that's the major component that you need to address first. And this is what happened to me, actually. So I've got rid of my different types of parasite, and the Lyme actually disappeared, went away. So the body got stronger, and the immune system could fight back and get rid of the infections. So that's the way to get rid of Lyme disease. That's not a medical route. It doesn't work. It makes things worse. I have so many people coming to me. They've done IV infusions for a long time. They've been antibiotic for 7, 8, 9, 10 years. There's no gut anymore. The liver is shut down. The stomach is destroyed. There's maybe kidney problems. So we need to fix all that and build back the immune system the way it needs to be, so your body can fight it and get rid of it. So when it comes to chronic issues, we need to think about Lyme first. When it comes to, for example, chronic pain, arthritis, okay, RA, low back pain, neck pain, typically I will see a Babesia concern, a Babesia issue in the tissues around these different bones and spine. And when we get rid of the Babesia, the pain goes away. So if you have, for example, chronic neck pain, if you need to get adjusted, go to the chiropractor. So I can bet you there's a babesia issue in your neck, in your tissues, in your body, causing the pain, because you shouldn't need to be adjusted regularly. You should be adjusted like once in a while, so your adjustment should hold. Same thing with low back pain or hip pain, knee pain. So there's always a babesia issues. When it comes to, for example, autoimmune issues like lupus, for example, RA sometimes, all those different issues that are related to autoimmune, typically I will see a Bartonella issue, sometimes I will see a Borrelia issue, sometimes there's a EBV issues. So all of those pathogens are actually the cause, the direct cause of the issues. And I can tell you from experience, after working with hundreds of Lyme patients and chronic issues, that there's a way to reverse the trend for your body. Instead of getting worse, for your body to actually improve and get better and get back to normal function. So this is what I had to say about it. So if you're concerned about your health or if you need any help, I wrote down my email at the bottom. You can leave me a comment or shoot me an email so we can touch base and help you. So thank you for watching. God bless you all.